Hair fall is a common issue for people of all ages. It can happen due to various reasons, like genetics, stress, poor nutrition, or even health problems you might not know about. Spotting the signs early and knowing what's behind hair loss can make a big difference in keeping your hair healthy and strong. Here in this video, you'll learn about the common causes of hair loss, easy ways to prevent hair damage, and effective treatments that can help you manage it better. What is hair loss? Hair loss, or alopecia, on the other hand, is a different hair condition from hair shedding. You lose excessive hair from your head with no signs of regrowth in hair loss. The effects of hair loss can be permanent and are influenced by various external and internal factors. If you lose more than 125 hair strands, then you may have hair loss and a reason for concern. Hair loss does not stop until the cause behind it is treated. Therefore, understanding the cause and treating it on time becomes very important. There are many types of hair loss conditions caused by various factors. Continue to know all these factors and ways to treat them. What causes hair loss? Hair loss caused by a disturbance in the normal hair growth cycle can lead to balding at any stage of life. Many internal and external factors can disturb the cycle and contribute to excessive hair fall. Some of these causes can be reversed, while others require proper medical treatments to slow down the process. Some of the major hair loss factors are 1. Hormonal changes and medical conditions. Hormones play an important role in how our bodies function, but they can sometimes disrupt the hair growth cycle and lead to hair loss. Hormonal shifts from things like pregnancy, childbirth, thyroid problems, or menopause are common culprits. Another factor can be alopecia areata, an autoimmune condition where the immune system mistakenly attacks hair follicles, causing them to stop growing hair. If not treated in time, this can sometimes lead to permanent hair loss. 2. Genetical composition. Androgenetic alopecia, also known as male or female pattern baldness, is a common hereditary hair loss condition. Men often see a receding hairline or bald spots on the crown, while women experience thinning hair or a wider part. It's caused by the hormone DHT, which shrinks hair follicles over time. Sensitivity to DHT is genetic, so this type of hair loss tends to run in families. 3. Mental and physical stress. When your body undergoes a physical or mental shock due to childbirth, accident, surgery, recovery from a disease, an emotional episode of losing a loved one or job, heartbreak, excessive workload, or examination stress, hair starts thinning. The reason behind stress hair loss is that the body starts to conserve the nutrients for the vital functioning, and non-vital function like hair growth is compromised. 4. Improper diet and lifestyle. Not consuming zinc, iron, proteins, and other vital nutrients can cause hair loss. Poor habits like smoking, sleeping late, and no exercise reduce the blood circulation to the hair roots, leading to hair loss. Due to a lack of nutrition and improper lifestyle, the hair becomes brittle, dry, and weaker, prone to breaking easily. 5. Medications and radiations. Several drugs used to treat diseases can cause hair loss as one of their side effects. Chemotherapy used for cancer treatment, drugs for acne, arthritis, depression, gout, blood pressure, etc. causes hair loss. Hair loss due to medications and radiations is termed as anagen effluvium as the growth stage is disturbed in this case. 6. Incorrect hair care and frequent styling. Using harsh chemicals, excessive heat, or tight hairstyles like braids and ponytails can lead to traction alopecia. This type of hair loss happens when hair is constantly pulled or exposed to damaging products, and unfortunately, it can be permanent. It's especially common among teenagers and adults who follow unhealthy hair care routines. Taking a gentler approach to styling can help protect your hair in the long run. What is hair shedding? Losing around 50 to 100 hair strands each day is a part of the natural hair growth cycle. This is called hair shedding, and the reason for that is the normal hair growth cycle. The hair growth cycle is divided into 4 phases. Anagen phase. The first phase is the active growth period, where hair grows from the follicles. This phase typically lasts for 4 to 7 years. Catagen phase. After the anagen phase comes the catagen phase, also regarded as the regression phase, where hair follicles shrink and last for 2 to 3 weeks. Telogen phase. In the telogen phase, the hair follicle becomes dormant and undergoes a rest period for 3 to 5 months. Exogen phase. This is the last stage of the hair growth cycle, where the hair strand completely gets detached from the hair follicle and new hair slowly emerges. This phase is also called the fall or shedding phase, where the old hairs fall off or are shed, which we can see while washing or brushing hair. After exogen, a new hair growth cycle begins, and the hair undergoes anagen phase. At any time, about 10 to 15% of your hairs are in normal shedding or telogen. Exogen phase, this comes to around 50 to 100 hairs which can be shed daily, which you see on your comb, towel and floor. This is a part of the normal cycle and is nothing to panic about. Telogen effluvium is one condition when this shedding percentage increases and you notice more hair fall, but not to worry. Telogen effluvium can be reversed by detecting and treating the cause. Treatment for hair fall. Treating hair fall depends on the underlying cause. Here are some standard treatment options that an experienced dermatologist would recommend. Medications. Over-the-counter treatments like minoxidil and prescription drugs like finasteride can help slow down hair thinning and promote regrowth. A study conducted by the Journal of the American Academy of Dermatology in 2002 showed that 60% of men who used minoxidil saw visible regrowth within 24 weeks. Laser therapy. Low-level laser therapy (LLT) is a non-invasive treatment that stimulates hair follicles and encourages new growth. Hair transplant surgery. Surgical options like follicular unit transplantation (FUE) or follicular unit extraction (FUE) can be effective for advanced stages of alopecia. Platelet-rich plasma (PRP) therapy injects concentrated platelets into the scalp to promote healing and minimize excessive hair shedding. Scalp micropigmentation. This non-surgical procedure uses microneedles to deposit pigment into the scalp, creating the appearance of fuller hair. Dietary supplements. Vitamins and minerals like biotin, zinc, and iron can support hair growth and reduce hair fall. Practical hair fall prevention tips. Preventing hair fall requires a proactive approach to hair care and overall health. Here are some practical tips to reduce hair thinning. Balanced diet. For hair health, eat a diet rich in proteins, vitamins, and minerals. Nutrients like iron, zinc, and biotin are crucial for reducing hair shedding. Gentle hair care. Avoid harsh chemical treatments, tight hairstyles, and excessive heat styling, which can weaken the hair shaft and increase hair breakage. Stress management. Practice stress relief techniques like yoga, meditation, or regular exercise to lower stress levels, which can prevent hair damage. Avoid smoking and alcohol. Both smoking and excessive alcohol consumption can contribute to hair fall by restricting blood flow to the hair follicles. Regular oil massage. Massaging your scalp with natural oils like coconut, almond, or olive oil can improve blood circulation and strengthen hair roots. Alright, that's all for today's video. Hair loss can feel overwhelming, but with the right understanding and the right treatment approach, it is something you can take control of. If you found this video helpful, don't forget to like, share, and subscribe for more straightforward guidance on hair care and overall skin health. And if you have any personal questions or want me to cover a specific topic, drop it in the comments. I'd be happy to help.